Meet Johnny, a pitcher making his way up through the minor leagues. Johnny dreams of playing in the bigs, but an injury almost stopped him from reaching his goal. One game, while pitching through the fifth inning, Johnny's arm started to bother him. He seemed to be losing control of his pitches. It didn't feel like he was able to throw very hard. He tried his best to pitch through it, but after a few more pitches realized that something was not right. Worried about his pitcher, Coach McBrickchin took a trip out to the mound to see what the problem was.
What's up, Johnny? How you feeling?
My elbow's just funky. It's tight.
Okay, we might take you out of the game then. Alright, let's go.
A few weeks later, Johnny's elbow still does not feel right, and his coach can tell.
Bring your good stuff.
I don't know. Like a few weeks ago when you pulled me out of that game in the fifth, my elbow was just feeling really funky, and it's still been tight for the last 2 weeks. I just feel like I can't throw very fast.
Okay. You know what? I think you should get Tommy John surgery. I think it'll really tighten up your elbow, and you'll be back in no time to throwing better than ever.
Okay.
Trusting his coach's questionable advice, Johnny decides to go see a doctor about getting Tommy John surgery.
And my elbow started hurting me, so my coach pulled me in the fifth, and hasn't felt right since. My forearm's stiff, my elbow kind of hurts. It feels really not really terribly painful, but it just hurts.
Well, it seems as if from what you're describing to me, it could possibly be a ulnar collateral ligament injury.
What?
This is a medial view of the human elbow. The superior bone is the humerus, and the inferior medial bone is the ulna. They are attached together with a ligament called the ulnar collateral ligament, or UCL, and it is also sometimes referred to as the medial collateral ligament of the elbow. There are two sections of the UCL, an anterior and a posterior. One function of the UCL is guidance of the elbow joint through its range of motions to full extension. Another function is prevention of excessive valgus forces through the elbow. Though direct causes of UCL injury may be multifactorial in nature, a few possible mechanisms such as glenohumeral internal rotation deficit and previous injuries such as lateral epicondylitis requiring arthroscopic elbow debridement surgery have been shown to increase risk for UCL injury. Ulnar collateral ligament reconstruction, or Tommy John surgery, is a surgical operation in which a ligament in the medial elbow is replaced with a tendon from elsewhere in the body. Usually, a tendon from the forearm, hamstring, or foot is used. It is named after the Yankees pitcher Tommy John, who first had the surgery. Post-operation, it takes on average about 4.4 months before initiation of throwing motions. Return to play, assuming that the rehabilitation has been complete and was successful, takes on average about 11.6 months. One thing to note, however, is that roughly 80 to 90% of UCLR pitchers returned to pre-injury levels.
So when I told my coach about my elbow, he told me to get Tommy John surgery to tighten it up and so I can throw better. What do you think?
Well, hold on there, Johnny. That's actually not quite right.
There are a lot of misconceptions regarding Tommy John surgery and pitching performance. Misconception 1. Tommy John surgery has a significant effect on pitching performance. This is not true. Through various cohort studies that have been conducted measuring the effects of UCLR on Major League Baseball pitching performance, it was shown that there was no statistically significant difference observed when UCLR pitchers were matched with healthy control pitchers of similar age, size, and experience. Misconception 2. Tommy John surgery can improve pitching performance in healthy players. UCLR does not improve performance beyond pre-injury levels. A study has shown that up to 28% of baseball players and 20% of baseball coaches still believe this. Misconception 3. Pitch type is not a contributing factor to UCL injury risk. This is not true. In fact, there is a strong correlation between types of pitches thrown and relative risk to UCL injury. Specifically, pitchers who throw more fastballs are at a higher risk of UCL injury.
Well, when you put it that way, maybe surgery isn't the best option. Rehab sounds like the right option for me.
Having taken his doctor's advice, Johnny had pursued conservative rehabilitation as treatment for his elbow. Unfortunately, several months later, he re-injured his UCL, this time much worse. Johnny's catcher immediately knew something was wrong and ran quickly to the mound. Coach McBrickchin as well knew something was wrong and ran to check on his ace.
What happened, Matt? He's getting back. Snap or something. Let's get you out of here.
It was a ruptured UCL. Johnny would need surgery. After a long year of rehabilitation, Johnny was happily back on the mound. He was feeling like his old self again.
Alright, nice practice, guys. Good work. Johnny, how's the elbow feeling? Good to hear. Looking like your old self out there. Thanks. Yeah, so moving forward, I've actually done some research since I gave you that showing advice. It turns out that every 1% more fastball you throw results in a 2% increase in the chance of UCL. Yeah, so moving forward, we're going to try and reduce your proportion of fastballs you throw compared to other pitches. Might have to work on your curveball. Things are looking.
Thanks for that research, Coach.
Using the information that Coach McBrickchin had given, Johnny stayed healthy and continued improvement. His continued improvement led to him accomplishing his lifelong goal, playing in the major leagues. Great job, kiddo. You did it. Fastball number of fastballs, not pitches thrown, can lead to UCL or surgery.